Hello and welcome. My name is Dr. Eliana Ramirez. I am the director of the Community Mental Health Equity Project Training and Technical Assistance Center, otherwise known as CMEP TA Center. Thank you for joining us today. We are welcoming you to our virtual community potluck. This is an opportunity for us to introduce ourselves as an exciting collaborative project to let you know what you can access from our TA Center and invite you to join us in community. So today we are going to be introducing our partner organizations and talking to you about our goal of serving up health equity across the state of California. I want to begin by acknowledging that the work we're doing today is building off of 40 years of incredible advocacy and organizing, planning, and work by people across the state of California who have been addressing health disparities at a local level. We're going to get in a little bit to talk about cultural competence plans, which are designed by county behavioral health departments every 3 years, oftentimes in coordination with community-based organizations at the county level, to identify health disparities and work toward health equity. And that cultural competence work is what began back in the 1980s. And so today we're coming together to build upon that work and look forward into the future to work together as county behavioral health departments and county community-based organizations. But this Community Mental Health Equity Project TA Center is actually part of a larger CMEP project, which is a really exciting initiative being spearheaded by the California Department of Healthcare Services and California Public Health Department Office of Health Equity, together with a steering committee, which also includes the California Behavioral Health Directors Association and CPEN, the California Pan-Ethnic Health Network. Together, we are joining to do a very exciting new work to move forward the cultural competence plans that I just mentioned into the next era. So today we're going to focus specifically on the TA Center portion of the CMEP project. And we're going to start off at our virtual potluck table here because we want to begin by acknowledging that there is space at our table for everyone. It is a round table. We invite people to come forward and join our work, whether you are logging in from a community-based organization or a county behavioral health department, you are all welcome here. And we want to give special recognition to the ethnic services managers who have been working tirelessly to address health disparities at a local level alongside community-based organizations who together are using both evidence-based practices and community-defined evidence practices to address the health disparities locally. We know that it is critical that when we address health disparities, we do so from a strengths-based perspective. So in addition to focusing on the experiences of elevated behavioral health challenges in our communities and the systemic issues of racism, homophobia, transphobia, biphobia, classism, and other issues that differentially affect our communities, we also know that there's an incredible amount of strength and resilience in our communities. And today, we're going to bring to you some of that strength and resilience from the organizations who are part of the partnership that is the CMEP TA Center. As we go into our partner organizations, to give you a little bit of a taste of what we bring as subject matter experts, we want you to know that when you put a TA request in on our website, those TA requests are provided at no cost to you, and you will be paired with one of these amazing experts who will be speaking today. If you make a request to us for something that is beyond the scope of our partners, we have a huge group of TA specialists also who are waiting in the wings, who are excited to meet with you and work with you as well. So without further ado, I welcome you to join us as we introduce ourselves. I'm going to start off right here with CARS, the Center for Applied Research Solutions. We are the project lead on this collaborative project. We bring quite a bit of experience with training and technical assistance, addressing health equity, especially through evaluation, and culturally responsive healthcare. We also run an MHSA-funded crisis care continuum and justice diversion project. And we have several people on the CARS team who are part of this project. I'll start off with myself. Again, my name is Eliana. I am a social worker by profession, and I have been addressing justice, equity, and diversity inclusion work for many decades now. I bring to you tamales. They are made among family. In my family, we make them every year together as a huge group. We are layering with laughter and love masa, which is the cornmeal, which is inside of the tamal. This delicacy is peeled back to reveal an unrivaled treat that predates colonization. And it is, in fact, a metaphor to talk about how, in spite of all of the multitude of challenges that face our communities, we still show up again and again and again with our strength and resilience. And I bring this to you knowing that this is one special treat from my family and my community that I offer to you. And I would now like to introduce my colleague, Ayana McGee. Ayana, would you like to introduce yourself, please?
Yes, and hello, everyone. It's such an honor to share the CMEP TA Center with all of you. I am Ayana McGee, the Associate Project Director on the CMEP TA Center, and I'm sharing with you candied yams. They are a very delicious part of my family meals. For me, I think they nourish the soul, and as a dense nutrient, they represent a certain kind of sweetness and kindness. And so thinking about the work that we do and the way that we engage with folks, just wanting to always operate in kindness. And we can move it on over to the next person on our team. And I am happy to share with you also Ande Pena as TA Specialist with the CMEP TA Center. Ande is sharing guacamole and says that when we bring our resources together, we can create sustainable foundations that individuals, families, and communities deserve.
Thank you, Ayana. And we're now going to invite Angela to introduce herself.
Hello, everyone. Welcome. My name is Angela Brand, and I am the field manager on the CMEP project. The dish that I bring to the table today is spinach, something that's often equated with strength and power. And in this space, I chose that as a reminder that what we put into ourselves can often have powerful results. And so when we take in the goodness, peace, and awareness, it strengthens our character, builds wellness, and contributes to the physical and emotional health and strengthens self and community. So thank you for joining us today.
Thank you, Angela. And I'm now going to introduce the PIRE, the Pacific Institute for Research and Evaluation, and invite Roland to introduce his organization.
Hello, everyone. My name is Roland Moore, and I represent the Pacific Institute for Research and Evaluation, or PIRE for short. We've been around for over 40 years and focus on the social environment, how a person's health-related behavior is shaped by family and community policies, norms, and histories, and that's backed by a lot of research that we do. Presently, we serve as the Native American Technical Assistance Provider team, and we support 7 Native Hub grantees in the California Reducing Disparities Project, and work with American Indian and Alaska Native communities is a particular strength of my colleagues and I. In terms of dish that I bring to the table, Greek village salad is what came to mind because I was thinking about mutual support and harmonious collective contributions, really representing the sort of eclectic and diverse, yet ultimately satisfying and nurturing work that my colleagues and I do. I'd also like to introduce 2 of my colleagues, Dr. Emily Houses. She is from the Chiricahua Fort Sill Apache tribe, and she highlights the annual fall feast in which women in the tribe prepare an amazing meal that's served to everyone who attends. And there's a collective feast that represents pre-Columbian times, as well as some more modern contributions, but there too, it's in the collective effort to both create and to serve that they find great strength. My next colleague I'd like to introduce is Dr. Elizabeth or Liz Waiters. Her offering to the table is Black Eyed Peas, and she harkens back to group activities, both shucking the peas and also telling stories at the same time for tender and loving, soul-filling work together. So collectively, we're ready to serve a diverse range of technical assistance requests and are happy to serve.
Thank you, Roland. I am going to invite Graciela to please introduce BEAM.
Hi, my name is Graciela. I'm the Mental Health Training Coordinator. BEAM stands for the Black Emotional and Mental Health Collective, and we're a national training, movement building, and grant-making institution that's dedicated to the healing, wellness, and liberation of Black and marginalized communities. I'm honored to be able to introduce L'Oreal, who's also my boss. She's so great, and my brilliant CEO, Yolo Akili Robinson. And what we're bringing to the table is some cornbread. And corn is such a main ingredient in so many dishes around the world. And we see that as such a huge core. And we also see healing justice in that same way. Healing justice is such a huge component to what we see for liberation and equity around the world.
Excellent. Thank you, Graciela. And I should have warned people that as we're getting started here, you might find yourself getting a little hungry as we show all of these different meals. And so I'm going to welcome Ashlyn Haskins to please introduce NAMI.
Hi, everyone. My name is Ashlyn. I am the Community Engagement Service Coordinator for NAMI California. We are a grassroots organization of families and individuals whose lives have been affected by serious mental illness, and we advocate for the lives of quality and respect without discrimination and stigma for all of our constituents. We provide leadership and advocacy, legislation, policy development, and also education and support throughout California. We offer staff that identify as diverse community members and that are bilingual and multilingual. We offer cultural responsive trainings, partnerships with focus and trauma-informed CBOs, and advocacy through statewide events, such as the BB Moore Advocacy Day and the annual Multicultural Symposium that we use to share innovative programs and actively and successfully address the disparities, bringing solutions to our community. We have about 56 NAMI affiliates that are diligently providing NAMI programs and resources and have strong relationships with diverse communities, cultural brokers, and stakeholders in the local region. Above is our Director of Workforce and Community Engagement, Ragini. Ragini, I don't know if she wants to introduce herself.
Hi, everyone. My name is Ragini Law. I'm the Director of Workforce and Community Engagement at NAMI California. And today, NAMI California selected the dish called Korean bibimbap. It's a rice bowl dish with plenty of different toppings from veggies, meats, eggs, kimchi, and sauces. It's a good representation of how there are various different food items that have unique flavors and textures. And just like how each diverse community members has their own unique characteristics and culture. And then when it's all prepared well, the dish brings all the different foods and items together in a harmonious way, and it elevates the dish. Similarly, diverse community members can still represent their unique culture and learn from each other in order to bring sustainable system in which there are reduced disparities and specific needs of each community still met. So one of NAMI California's goals are to raise awareness about the importance of equitable and sustainable access, and as well as continuing diverse representation in mental health care. Thank you.
Thank you so much, Ragini and Ashlyn. We are now going to go over to Lindsay, who will introduce Special Services for Groups, SSG.
Hello, everyone. My name is Lindsay. I'm introducing Special Service for Groups, SSG,
It's a direct social services, technical assistance, and policy advocacy. It serves counties of Los Angeles, Orange, Riverside, and San Francisco. The research and evaluation team advances SSG's mission to build community capacity through a variety of services and trainings that are tailored to be responsive to local histories, cultures, and political contexts. My name is Lindsay Chen, MSW. I'm a senior research analyst, and the dish I chose is Kalsuet, which is my favorite Burmese Myanmar noodle dish that my mom makes. And my family grew up eating this. It's served with rice noodles, thick curry, tofu, bean sprouts, romaine hearts, and crushed peanuts. You start with yellow coconut curry, milk curry, and you add noodles, toppings, including crispy onions, crispy noodles, cilantro, peppers, and lime. And I think it's the perfect combination of a diverse flavor palette that promotes health and comfort. It's rich. It's a culturally rich traditional meal, and it represents elements of community health. We've also got Erica Jun, MPH, MA. She's a co-director at SSG R&E. She chose japchae, which is a colorful, flavorful, and has a little bit of everything. And it's so much more than the sum of its parts. It represents the individual characteristics, but recognizes the group that's created when all the pieces come together. Trang Huang, who's a licensed social worker, PhD, is part of the SSG API Equity team. She chose Rau Muang, Rau Ren, Rau Cao Lang, and these vegetables are part of staple diet in many households, but not well known as Vietnamese cuisine. This pairing of highly nutritious bland vegetables with spicy fish represents the combination of our available services, but requiring outreach and engagement to make accessible to our populations. And finally, Jesse Damon, MPH, co-director of SSG R&E. Growing up on the Gulf Coast, red beans and rice were a staple in his home. They are comforting, frugal, and elegant in their simplicity and draw on rich African and Caribbean food traditions of the region.
Thank you, Lindsay. I don't know about anyone else, but I am reacting very strongly and positively to all these beautiful dishes. So I'm going to welcome Lucero to please introduce CalMesa.
Good afternoon, everyone. My name is Lucero Robles, and I am a licensed clinical social worker and the Director of Quality Assurance at the California Mental Health Services Authority, known as CalMesa. And so we're a joint powers authority. Also on this project is my colleague, Michael Helmick, and he's not here with us today, but we are representing CalMesa. CalMesa develops and implements services and programs on behalf of counties. So specifically, behavioral health programs. So CalMesa leverages data and designs programs to maximize the impact on behavioral health programs and the outcomes of the individuals that they served. Those programs we develop and implement can be locally, regional, or statewide types of programs. And what we're sharing with you in terms of our dish are tamales because they're good. They also show diversity in how they're made and the items that they use to stuff them. And then lastly, because at least for us in my family, it is a very familial thing. So we get together and we do this and lots of love and laughter along the way. CalMesa is very excited to be part of this project. So thank you.
Thank you so much. And we will invite Angela to please introduce Change Matrix.
Thank you. I'd like to introduce our partner, Change Matrix, a women-owned, minority-owned small business. They work to motivate, manage, and measure change, a structured approach to assess the situation, define outcomes, and tailor processes and tools. In partnership, individuals and organizations transform from their current state to a desired future state. The partners on this project are Suganya Sakalingam and Elizabeth Weitzig. The dish that they chose to share with us today is paella. Representing their work is each individual ingredient is easily identifiable, does not assimilate into one color or form, and collectively tastes great.
Thank you so much. And we're going to invite Ken to please introduce the LGBTQ TA Center.
Hello, my name is Ken Einhaus, and the LGBTA Center provides no-cost technical assistance and training to 7 grantees funded through the California Reducing Disparities Project. They are implementing community-based programs serving the mental health needs of California's LGBTQ populations. Over the course of 6 years, we have worked intensively with these grantees to promote their strategic planning, effective implementation of community-defined evidence practices, rigorous evaluation, scaling them up successfully, and achieving ongoing sustainability. The dish I have chosen to somewhat represent what we do is a dish that I started cooking as a child when my mom worked during the night shift for my family. Plain old macaroni and cheese. And as I grew up, I learned to incorporate more nutritious ingredients and make it from scratch. It turns out that the more you add, the better it is for you. And so too, our healthcare services. People start out serving the general population, and it turns out that the more you pay attention to serving everybody in your community, incorporating them into your services, the better it is for everybody. And so that's my analogy for what we do, I think, in health equity, is paying attention to the needs of everybody in the community, ensuring that they are represented in your healthcare services.
Excellent. Thank you. We are so proud to be working with and honored to be working with the partner organizations who bring such eclectic expertise. And we are thrilled to invite you to submit a TA request for training and technical assistance. If you were to go to our website, you would see a button where you can submit a TA request. It just takes a couple of minutes to do. Again, we provide TA at no cost. We provide consultation. If your group is interested in thinking about how to use data, for example, to identify health disparities or to measure the outcomes of your work to achieve health equity, we would be more than happy to pair you with somebody who could come and do a consultation for your team. Or perhaps you're looking for a training or resource sharing. We also have regional academies and learning collaboratives that will be starting up later this year and the beginning of next year. These will be opportunities for you to learn alongside others who are doing similar work at the county level or in the community-based organization level. We know that you are the experts of your own community. And when we are able to pair you with other experts of local communities, really incredible things can and do happen. And we are excited to offer those upcoming regional academies and learning collaboratives. And then finally, we will have a digital storytelling project, which will be an opportunity for you to really share and showcase the phenomenal work that you're doing at a local level. In order to design that training and technical assistance, we are engaging in a community data gathering. Our first event was a kickoff event where we did this potluck presentation, and we asked polling questions of the audience to figure out what was the most effective kind of TA that you've received in the past. And we're using that information to ensure that the kind of TA that we provide and design really is based off of successes of the past and process improving to avoid challenges that oftentimes can happen with TA. So we are excited and grateful for the feedback from that first polling event. Additionally, we are engaging in a variety of data collection, from listening sessions to surveys, and we're doing field work, going to the community, attending meetings, as well as recording short interviews with subject matter experts in what we call cafecitos, which means small coffee. In total, these different types of community data gathering are for two reasons. One is to collect information about the kinds of training and technical assistance that would be most helpful to support your work in addressing local health disparities, as well as collecting information about county and CBO's experiences with cultural competence plans. So as I mentioned from the beginning, cultural competence plans are written every 3 years. Typically, the ethnic services manager at the county behavioral health department writes the plan in coordination with others at the county and oftentimes also with community-based organizations. As I mentioned, this incredible work actually dates back to the 1980s when people first started to talk about the need to address health disparities on a systems level across the state of California. Eventually, in 1997, the cultural competence plans are written into law, and they build on recent recommendation considerations. For example, the National Culturally and Linguistically Appropriate Class Standards and the Mental Health Services Act data changes are two different pieces that impact the cultural competence plans of today. Right now, what we're doing is collecting robust community feedback to help us to think about recommendations that the community would like to make for DHCS, the Department of Healthcare Services, to consider in revising the guidance that leads to the cultural competence plans. So to date, we have heard from over 200 people from across the state of California who have attended our listening sessions. We are conducting several additional listening sessions and are about to release a survey. And as I mentioned, we are attending meetings in the community to also listen in and meet people where they're at, to hear about the issues that are most important for identifying health disparities locally and planning services to address those health disparities, ultimately for the purpose of increasing health equity across the state of California. So we hope that you've enjoyed learning a little bit about us, about the dishes that we bring to our community table. We want to just close by acknowledging that the reason why we use this metaphor is because if we were outside of the pandemic and meeting in person, we probably would have invited you to an actual potluck where people can share a little bit about themselves and we can together be nourished off of the strengths of our community. We do offer this metaphor acknowledging that there is quite a bit of disparity across the United States and that hunger is a significant issue that affects so many of our communities and especially our diverse communities. And we welcome you to go to our website, submit a TA request where we can pair with you. We are excited to learn with you and build alongside of you in the critical work that you are doing at this moment in time. So thank you to you as the audience. Thank you to the partner agencies who have presented today. Thank you to our collaborators on the larger CMEP project, the California Department of Healthcare Services, the Office of Health Equity, California Behavioral Health Directors Association, California Pan-Ethnic Health Network, who are part of our steering committee for the CMEP project.